Patients say this to me almost apologetically. Doctor, I know I shouldn't eat like this. It's emotional. And I usually pause because sometimes it's emotional eating, but very often it's not. It's hormonal eating, and treating biology like a behavior problem is why so many smart, disciplined people feel like they keep failing. If food feels louder than logic, this will finally make sense. This is the main problem. We blame behavior when the driver is physiology. Most weight loss advice treat eating as a character issue, stress, habits, self-control, discipline. So when weight loss stalls, the message becomes try harder. But physiology does not respond to motivation. There are three there are different drivers of hunger, and confusion them guarantee failure and shame. This is the clear truth. Emotional eating and hormonal eating feel similar, but come from opposite systems. They are not the same problem. Let's talk about emotional eating. They are the brain driven. This is about coping, not a true hunger. Typically, the features are triggered by stress, boredom, anxiety, specific comfort food cravings. Eating can continue despite fullness. Relief is emotional, followed by guilt. Food here acts like temporary emotional anesthetic. Therapy, awareness, routine stress tool, these work when this is the driver. The opposite for hormonal eating, it's body driven. This is biological urgency, not emotion. And the typical features are persistent hunger. Hunger returns quickly after meals. Cravings feel non-negotiable. Food thoughts persist even when life is calm. And they are driven by signals like ghrelin, the hunger hormone, insulin, storage and rebound hunger, leptin resistant, satiety failure, cortisol, the stress metabolism. And remember this, hormonal hunger does not ask for permission. So what most people actually have, the blend together. Hormonal hunger often creates emotional distress, low energy, irritability, anxiety, urgency. This feels emotional, but the trigger is biological. Let me reframe it. Sometimes the emotion is not causing the eating. The hunger is causing the emotion. This is where patients get mislabeled. And this is where the logic gap is. Let me expose it. Patients are told track calorie, be disciplined, control emotional eating, but their body keeps screaming for food. That's not a mindset failure. That's a signal mismatch. The brain thinks enough, the hormones disagree. You cannot out-discipline biology indefinitely. Let me be explicit. This is not weakness, laziness, moral failure, addiction by default. Hormonal eating is physiology, not personality. Blaming chemistry with willpower is bad, bad medicine. Let me tell you about the real saboteur, the part that almost no one explains. Your body defends a weight range, a set point, we call it. When you diet below that point, hunger hormone rise, metabolism adapts downward, food focus intensifies. This is critical to remember. Your body doesn't interpret dieting as progress, it interprets as a threat. Hunger here is not broken, it's defensive. So you would ask, why diet fail in hormone eating? Calorie restriction increases hunger signal, raises cortisol, makes food louder, not quieter. So patients think, I am doing everything right. Why is this harder? Because willpower becomes a temporary loan with interest. Let me compare craving and hunger to make it clear in your mind, because this distinction actually matters. Cravings equal reward and dopamine. Hunger equal survival signal. Cravings negotiate. Hunger does not. If logic still works, it's likely emotional. If logic is ignored, it is hormonal. So let me mention something about the timing patterns, because the patterns can tell you the story. Hunger at night, it is cortisol with insulin. Hunger early morning, it's a sleep debt and ghrelin. Hunger 60-90 minutes after meals, insulin resistance. Timing reveals biology. Let me tell you something special and why women are hit harder. This matter and it's often ignored. Hormonal eating is more common and intense in women because of estrogen fluctuation, premenopause and menopause, post-pregnancy metabolic shift. Same advice, very different physiology. So how to tell the difference? So ask those questions. If hunger improves with distraction, it is emotional. If hunger ignores distraction, it's hormonal. If hunger worsens with dieting, it's hormonal. Different driver, different solution. So why hormonal eating needs medical strategy? Fair question. Hormonal hunger improves when you address insulin resistance, sleep and stress hormone, protein signaling, gut and brain, the communication between them. That's why medically guided weight loss, hormone stabilization, endoscopic or metabolic interventions work when diets don't. Not because patients are weak, but because biology is loud. Here's a reframe that change the outcomes. If hunger feels negotiable, it's emotional. If hunger feels relentless, it's hormonal. Stop fighting the wrong enemy. So, when to seek help? I would say get evaluated if hunger returns quietly after eating, diets work briefly then fail, weight rebounds predictably, hunger feels out of proportion, That's not motivation, that's medicine. I am not. I'm not saying emotion does not matter. I am saying hunger has more than one language, and when we misinterpret it, we blame the person instead of fixing the system. Understanding the difference restores outcome and dignity. This is Dr. BenMaamer. Become a follower, and together we'll change the movement and transform healthcare in America.